Hi there, I'm Aislinn.
Hi, I'm the boss.
Nice to meet you.
Did you find us okay today?
I did. Thank you so much for making yourself available for this interview.
Let's get started. So with this job, physical therapy technician, it is an entry-level job that allows you to become acquainted with the roles and duties expected of a physical therapist or physical therapist assistant. Here at Miami Valley Sports Medicine, we strive to make our patients feel like they are getting the attention they need through our techs, providing them with exercise instruction, keeping the clinic clean, and assisting the patients in doing their exercises correctly. So to start, can you tell me a bit about yourself?
Sure. So my name is Aislinn Ballinger, and I've received my bachelor's degree from Miami University in 2021 for kinesiology and health. I played soccer and track growing up and continue to remain active. And I think it's very important for preventative medicine to be implemented in many people's daily lives. I have found a passion for helping people and doing it through conservative care, like exercises in their daily lives. And I feel this is one of the best ways I can help people. And I would love to learn the building blocks for the career I wish to go into, which is eventually physical therapy assistant or PTA.
Great! It can get very busy in the clinic day to day, with many patients coming through needing assistance and cleaning jobs piling up. How do you handle stress and pressure?
Oh, good question. For me personally, if I become overwhelmed, I'm not afraid to ask for help. I would rather the company look good and the patients feel that they are being served than to muddle through and do it all myself while the patient care slips. I think when things get chaotic, there is no way out but through. So just getting through it to the best of my abilities while maintaining the best patient care. The best patient care that I can is how I handle a lot of stressful situations.
Very nice. Now, why do you want this job?
Sure. One of the biggest reasons why I want this job is to become acquainted with the everyday job that a PTA would be doing. Seeing how other PTs and PTAs treat their patients and then what modalities they use when treating them is very important to learning how I would treat them if I was doing it myself. Finding my own treatment style for in the future when I have to do it myself. I want to become a skilled worker so when it matters to my patients, I can show up for them.
Okay. So then why should we hire you?
I think it would be a great hire because I'm very personable and work well with most everyone. I strive to make sure patients feel like they are taken care of thoroughly and they aren't left feeling like they could have received better care from anyone else. I'm also very efficient and make sure I am getting done what I need to as fast and effectively as I can so it can leave me time to take care of other cleaning duties and things that need to be done regularly around the clinic besides patient care.
So if this job is not your final stop, where do you see yourself in 5 years?
In 5 years' time, I plan to be working as a physical therapy assistant in an outpatient orthopedic physical therapy center, as that is where my interests lie. I intend to become certified in something such as vestibular or dry needling so I can help more people and also market myself better. I am very ambitious, so I'd like to be able to find a clinic that will pay for my continuing educations or my CEUs to keep my license up to date. Maybe after working for a while as a PTA, I could see myself going back to school to the Bridge program to obtain my doctorate in physical therapy. So jumping from a PTA to a PT could be what I see myself in the next 5 years.
I see you are very ambitious. So what do you expect to learn from this job position?
I think there's a lot to learn from a job like this. I think that communicating with patients is a crucial part of being a PTA, and having to talk to patients and explain to them exercises in a way they will learn will be a good thing to have under my belt in the future. I think also learning how to deal with insurance will be beneficial in the future because so much of the medical world is run by insurance. Once I have a good grasp on that, it will only help me. I also think that having this job will help build my resume so in the future another employer can see that I have worked in the field for a while.
There are a lot of things to be learned from a job such as this. So would you take a job for less money?
Because this job is helping me learn things I would not have gained besides working in the field firsthand. There's something to be said for an amount of experience that does not have a price on it. If my end goal is to help people and I enjoy doing it, then yes, I would make less money to make sure I am making a difference in my life and theirs. but there has to be a balance because I would also like to exhibit that I'm a good worker and deserve a higher pay. So as long as there's an opportunity to earn higher pay in the future, I would take a pay cut for a short period of time.
Very good. So can you describe for me a time when you have learned from your mistakes?
Gladly. At my old job, I worked as a smoothie maker and would remember things about the regulars who would come in and have conversation with them. We would update each other on some of the things we had mentioned before, and we would sometimes become like friends. I made the mistake of telling a customer some personal information because I conflated the lines between customer and employee. And then every time after, when they came in, they would want to talk my ear off about my dilemma or give me unsolicited advice as to what I should do. It started to get in the way of my job, and they could sometimes hold the line up and cause other customers to become irritated at ultimately my lack of professionalism talking with a customer about my personal life. I figured the only way to solve it would be to speak with the customer about my issue I had caused. One day when they were in and we were not busy, I had asked them to politely refrain from speaking to me about it anymore as I'm starting to look unprofessional to other customers who don't know the whole story. If they really cared for me, even as a smoothie employee, then they would oblige. And they did. Communicating with them in an honest way made it so we were on the same page and I handled the situation like an adult. That was one of the mistakes that I've made that I have learned from since then.
I understand that would be a hard position to be in, but I'm glad you made it so it wasn't a problem for you anymore. So then I am curious, what do you do if your boss is 100% wrong about something? How would you handle it? Explain a time when this happened to you.
Sure, this is a hard one. I am very respectful and most often do what I am told by a superior, even if I don't agree with it. I think one of the times that comes to mind is when a boss at another clinic told me I should take a patient through an exercise that I thought was not safe for them. They're a clinician and I'm not, so it should be fine. Though judging by the way the patient walked around, I did not feel like he could have completed the exercise safely. I asked the patient if he thought he could complete the exercise, and he said he did not think he could either. So I told the clinician I did not feel comfortable taking the patient through the exercise. I thought surely he's going to get mad at me and be upset that I did not do what I was asked. But he actually respected the fact that I put the patient first and preferred the clinician to help and not myself. I learned to speak up for myself in that moment and speak up for the patient as well.
Very good. Well, is there anything you would change about this job that will help you in the future and why?
I think something that could help me more in the future is the documenting side of things. I would like to be able to scribe what a clinician details to me about the patient. So I am writing as they are feeling around the patient or working with them one-on-one. I think this would help with my documentation skills that I will need in the future. And I will be able to be hands-on with how proper documentation should look in the future.
Well, thank you, Aislinn, for coming in and speaking with me today. We will be in touch with you to tell you about the job.
Thank you so much for the opportunity to speak with you. I will be in contact soon. Have a good day.